When Shannon Alley has a sick kid, she turns to a homeopathic cough and cold remedy.
I prefer an all natural, something that's a little more from nature.
And she figures if the box is on the same shelf as pharmaceuticals like Tylenol or Advil, it must meet the same scientific standard.
I would think that they're both the same if they're both being sold sort of in the same section, because they're usually not too far away from each other.
But in reality, homeopathic products don't need to prove they work the way over-the-counter drugs do. Though a Health Canada survey found 2/3 of Canadians believe they do. And the agency says that's a problem.
What we want to achieve, and that's what we're consulting on, is making sure that products that have specific claims are supported by similar level of evidence.
It certainly isn't like that yet. 2 years ago, CBC Marketplace created this fake natural product and got it licensed. Health Canada never required scientific evidence that it did what it claimed. Effective relief from fever, pain, and inflammation in kids. Soon after our broadcast, a new safety alert from the government aimed at homeopathic products, no longer allowing companies to make specific health claims for cough, cold, and flu for children 12 and under, unless those claims are supported by scientific evidence. To many, it looked like a new guideline, meaning the labels would have to change. No more words like effective relief. The change was expected this March. But take a tour of the shelves now, and there's almost no change. Just one brand we found has this note, not based on modern science.
This is deceptive.
This doctor thinks that changes don't do much to help consumers.
You know, the biggest text on this is cough. This is for cough. And so the average person will probably see nothing more than this relieves cough.
That's the perception Health Canada was challenging. But the homeopathic industry pushed back. In a letter sent 5 months ago and obtained by CBC, it fought to keep its label claim, suggesting that addition of information to pediatric labels, such as the note that products aren't based on modern science, would be preferable to the removal of information. The letter suggests Health Canada agreed. And the agency says 98% of homeopathic brands are complying, but it relies on what those brands tell them, rather than verifying what's actually in stores. When we looked over the past week, 3 of the 4 top brands have made no change at all.
I'm left thinking that we haven't solved this problem at all, and that the government needs to act and implement some regulations and enforce them and not just talk about it.
This wouldn't be the only example of things that we find on the shelf that, to use your words, say cough and cold, that suggests relieves dry cough, relieves congestion. It's clearly marketed at kids 0 to 9.
In those cases, we want to have that information, so provide us the details and we'll look at that.
So we asked the industry, why have most labels not been changed? Phil Waddington is the top lobbyist for Canada's homeopathic products.
Within the retail level, if the old products haven't sold off, then that's why you'll find some of the products on the market now that still have the old labels. They're still compliant with the regulations, but the new labeling changes that we've agreed to and are putting into place may not have made it to the shelves yet.
For every non-prescription drug product on the market, there are 20 natural health products on the market, many of which look indistinguishable from those drug products.
Is Health Canada backing down here?
One hopes not, but you always worry about the influence of lobby groups and big businesses, and there's no question that the natural health products industry is a multi-billion-dollar industry with lots of influence.
And smart marketers. We asked one brand if they were in compliance. They sent us their new label. Doesn't look that different, but look closely down there at the bottom, suitable for kids older than 12. And so, over the age targeted by Health Canada, thus exempt from their demands.
I would totally have bought this.
Now that Mom Shannon knows all this, she's planning a change.
But I think now, just based on my own thinking and now that I'm talking it out, I probably should just be getting the ones that are scientifically proven to make them feel better.
It's about having the relevant information, something Health Canada was insisting should be in front of Canadian parents. David Common, CBC News, Brampton, Ontario.